that can happen, how it can be prevented, and all that. Okay. So this is just to show, the purpose of showing this slide is two. Number one, to show how much our services are being utilized. So as you see this figure, this is our patient population per year. About 74,000 people are availing our services every year. And the second purpose of showing this slide to you is to make you aware the number of people who has these kinds of problems in our country. Okay, so we get about 13,000 people with hearing problems in a year, and almost about 12,000 people with the speech and language problems. Okay, so the outline of my talk is like this. Uh, it is divided into two sections. The first section I'll spend on the hearing impairment part, the types of hearing impairment, and the healthcare technologies which are available at present to diagnose and assess the hearing impairment, as well as the current research which is going on in this area, as was informed to me by Dr. Vijay. Many research scholars are also participating, so I would spend quite a lot of time on the current research, what we are doing and what is being done in other parts of the world also. In the second part, I would be dealing with speech disorders, the types of speech disorders, and again, the existing methods and the current research. So basically, I would like to have interactive session. So even though this is on a virtual platform, my request to all of you is, whenever you feel whenever you have some doubts in your mind, or whenever you feel like asking questions, please do interrupt me uh, in between, and you are free to ask your questions. So I would prefer to hear the questions from you rather than hearing it through the chat box. Okay. So please be interactive. Okay. So with that, we'll move ahead. So when we say hearing impairment, obviously it is the inability of an individual to hear sounds adequately. And this problem is quite familiar to all of us because our parents or grandparents or someone in our family uh, is having this problem or must have had this problem. And the reason for hearing impairment is many. It can be due to improper development of the hearing mechanism, or the damage or disease to any part of the hearing mechanism. Okay, so it means that all of us may be having a perfect hearing mechanism now, but it can get damaged, or the problems can arise due to many reasons. Now, when we talk about people with hearing disability, basically we have to consider them in two categories. The first category is persons with hearing loss. So they have their residual hearing in them, but it is reduced hearing. So if in some way, if we are able to compensate their hearing problems using technology or devices, they would be able to hear better. The second category is people with complete hearing impairment, which whom we often call as deaf people. So as far as the technologies are concerned, the technologies are available for both these kinds of people whom we consider under the hearing disability. Now, when we think about the hearing mechanism, this picture which we might have learned in our biology classes in the 10th standard or 12th standard comes into our mind, where we know that the ear is split into three sections: the outer ear, middle ear, and inner ear. So the process of hearing is a combined action of all these sections, when they work in tandem, when they work in coordination, we would be able to hear sounds. So we will see a small video, a very short video, which will show us about this activity, and then after the video we'll move ahead.
And is directed through the ear canal, where it first reaches the eardrum. As the eardrum begins to vibrate, it sets
So
the
you can
ossicular
see
chain
the
in motion.
tympanic
The ossicular
membrane
chain
moving.
consists of the hammer, anvil, and the stirrup.
Now the middle ear section
Sound
is
vibrations
responding
move
to
along
sound,
the ossicular chain and into the inner ear.
and now the
Within
vibrations
the
goes
inner
to the
ear,
inner
the
ear,
cochlea plays a central role.
and you can see a coiled structure
It is
there,
here
which is
that the
called the
mechanical
cochlea.
energy of sound is converted into complex electrical signals, which are then passed on to the brain. In
So
simple
now the
terms,
electrical
the
signals are
cochlea
getting
is a
generated,
spiral-shaped tube filled with
which is
fluid.
passed on to
Sensory
the brain.
cells, also called hair cells, line the
So now the hearing problem can be because of the problem in any one of these sections. And the hearing problem not only affects our ability to hear sounds, but it also affects a variety of features which we get add on with the process of hearing. You're all aware that when you talk to someone over phone, if that person's voice is familiar to you, without revealing the person from the other end, you can clearly distinguish whom you are speaking, because his voice is familiar. Okay, so along with your hearing, you are gifted with a property of object identification or speaker identification. Then the second add-on which we get along with the hearing is sound localization. So suppose you are walking, and if somebody calls you from the back, you know that the sound is coming from the back, and immediately you turn your head towards the back. Okay, so that's because you are able to localize sound. Then you are able to enjoy music. So when you listen to music, even recorded music, you can identify, you can perceive the sounds coming from different musical instruments. Okay, without somebody telling that that sound is from violin or that sound is from guitar, you're able to perceive and distinguish the sounds coming from different musical instruments. The next one is speech perception. So when you listen to someone, you are hearing, along with that you are comprehending the message which is conveyed to you. So if somebody says hello, good morning, the message reaches your brain what the other person what the person on the other side is meaning. Okay, so that is speech perception. Then another important feature which the ear has is listening to desired sound amidst noise. So, so in many situations we are forced to listen to, or have the we will have the need to talk to persons who are next to us in very crowded places like bus stands, railway stations, etc. Okay, so even though the background noise is very high, you will be able to listen to the person whom you want to talk amidst all the noises. So the ear focuses or tunes to that particular person, which helps you to listen to the desired sound amidst noise. Okay, so these are all the add-on features which comes to you with the process of hearing, and this happens only when the sounds which are received by the ear are processed by the ear, and once it reaches the brain, which gives appropriate signals. Okay, so when you have a problem in the hearing mechanism, it's not only the audibility which is affected, it is all these features, your ability to have speech perception, your music perception, your speaker identification capability, and your capability of listening to desired sound. All these are getting, and your ability to localize sounds or detect the source from which, or detect the direction from which the sound is reaching you. All these properties will get affected. So if we define hearing loss, it is defined as diminished acuity to sounds which would otherwise be heard normally. So if a person can hear a sound, if you cannot hear that particular sound, then definitely you have hearing loss. So therefore, the hearing loss is measured on a comparative scale. It is measured as the difference between a hearing impaired person's hearing threshold and that of listeners with normal hearing. So if a person with normal hearing can hear a sound at 10 dB level, and if you are not able to hear that sound at 10 dB level, instead of that you are hearing at 30 dB or 40 dB, then you have a hearing loss of 40 minus 10. The normal person is hearing at 10 and you are hearing at 40 dB, then your hearing loss is 40 dB minus 10 dB, that is 30 dB. Okay, so it is a comparative measure. And the hearing loss is expressed in terms of hearing threshold, and that is the level of sound, that is the minimum level of sound pressure which is required for you to perceive a tone. Now, with this introduction, let us move to the different types of hearing impairment. So if you have a problem in your outer ear or middle ear, then you are said to have a conductive hearing loss. And if you have conductive hearing loss, the causes for conductive hearing loss is the infection in the ear canal. So due to sometimes when we get affected with cold or some infections in the ear canal, that can lead to problem in hearing. Then it can be because of fluid in the middle ear, or if there is any hole in the tympanic membrane, perforations in the tympanic membrane, and if due to some accidents, if there is a dislocation of the ossicles, then it can lead to problems. And symptoms, you will not be able to hear soft sound. So say if somebody speaks in normal voice, you will not be able to hear. Now when I am talking to you, my level of speech is about 65 dB. So all levels of speech which are less than 65 dB, they are called as soft sounds. And if the intensity level of speech is above 65 dB, then it is called intense sounds. Okay, so people with conductive hearing loss, they will not be able to hear soft sounds, and intense sounds, loud sounds, will be reduced in loudness for them. Another type of hearing loss is the sensory neural hearing loss, which caters to about 90%. That means 90% of people with hearing loss has got this sensory neural hearing loss. And cochlea in the inner ear or the auditory nerve will get affected, that is the reason for this sensory neural hearing loss. Okay, so it can happen because of aging. So most of our senior citizens who have hearing problems, they are having the sensory neural hearing loss. And it can happen also because of long exposure, long period of exposure to loud sounds. And it can happen because of viral infections also. It can be because of the genetics issues also. So here also you will not be able to hear sounds at lower intensities, whereas the intense sounds are heard. So that is why often when we talk to elderly people, we speak little loudly so that they can hear. So if the sounds are at little higher level or are of high intensity, they will be able to hear, whereas they will not be able to hear soft sounds. And in some people you will have mixed also. both conductive and sensory neural hearing loss. So another type of hearing loss is the central auditory processing hearing disorder, which is because of the problem in the auditory system. So once the sound is processed by the outer ear, middle ear, and inner ear, and once it is sent to brain, the brain has to process it. Then only we can perceive it, and we will come to know what is being heard, the meaning of the sentences or the phrases which we are hearing. So for that, the auditory system has to be perfect. So if you have a problem in the nerve which is connecting your inner ear to the brain, if there is a lesion in the nerve, then you can have this central auditory processing disorder. So tumors, lesion caused by stroke, other changes in the neural structure, all can lead to this. The problem with the symptoms of this disorder is that you will be able to hear sound, but you will not be able to recognize. So if I'm speaking about 10 words, out of the 10 words, you will be able to recognize only 2 or 3 words, okay, only 20 to 30% of the words. So that was all about the types of hearing impairment. So I'll take a short pause here, and I would request the audience, if you have any clarification on what we have seen till now. Any questions? Even you can type in the chat box also if you have any questions.
Sir, I have a very basic question. Like some of the persons are seen with deaf and dumb kind of disorder. So, is there any relationship between speech and hearing? There is any loss persist?
Okay, that's a good question, Vijay. And later in my presentation, I will be addressing this issue. Persons who are completely unable to hear sound, that can be because of several reasons. One reason is by birth. They are unable to hear those sounds right from the birth. So it can be problems because of problems in the inner ear. So that can be compensated with the cochlear implant now. Okay? So there what happens is the cochlea has got a particular type of hair cells called inner hair cells, which connects whatever you have received, the vibrations which you have received, that gets converted into electrical impulses by the cochlea. So if these inner hair cells are absent by birth, okay, then it leads to complete hearing impairment. So that is one of the major causes for complete hearing impairment. So if you are unable to hear, then that will definitely affect your speech also. So when I go to speech disorder, I'll be explaining that in detail. So there's a question in the chat box. Can you elaborate on conversion of sound signal to electrical signal? Okay. So this conversion is done at the inner ear when the sound vibrations, when it reaches the inner ear, these vibrations are converted to electrical impulses, okay, by a membrane called basilar membrane, which is present in the cochlea. So there what happens is, like we have small hairs on our body. So those types of hairs are there in the inner structure of the cochlea. So these hairs we call as hair cells, and these hairs vibrate with response to the sounds which we hear. And these vibrations, when they rub on the basilar membrane, it gets converted to electrical impulses and they are carried to brain. So as Dr. Vijay raised the issue of total deafness, so one of the reasons for the total deafness is the absence of these hair cells, where the conversion mechanism from sound to electrical signals, electrical impulses doesn't happen. So the total connectivity between the ear and the brain is lost, which can lead to total deafness. Hope I have answered your question correctly.
Thank you, sir.
Okay, so shall we move ahead?
Yes, please, sir.
Okay, so now with this introduction and a very basic concept on the hearing impairment, causes of hearing impairment and types of hearing impairment, we are going to see some of the technologies, some of the major technologies which are used to detect and assess hearing impairment. So these are the different technologies which are available right now for assessment of hearing. So we will start with a small video which will show you how some of these assessment technologies work.
Important clues about some conditions that may affect hearing can be obtained through.
So this is a test called otoscopy.
Good. Just check the other one. Otoscopy also establishes whether the patient's ear canals are sufficiently free of wax or other debris to receive the testing. Okay, just throw into this room here. We're going to do it.
This is another test called emittance audiometry. This is basically to find out whether your middle ear is proper or not.
So I'm just going to put this little rubber tip in your ear. You'll feel a bit of a change in pressure, but you don't need to do anything.
Okay, so they are inserting a probe into the ear. Then they'll be sending a sound to the ear. And if you observe the screen, you get a graph which is called the tympanogram. So if the shape of the graph is perfect, then your middle ear is perfect. This is the audiometry test where you will be presented sounds at different frequencies, and when you hear these sounds, you have to press this button. So this is done for both the right ear and the left ear.
So it just sort of goes in your ear like a phone implant. The procedure for establishing an audiogram from an adult client begins with air conduction.
So she's inserting the earphone into the ear.
Headphones, or these insert earphones, are used to deliver the stimuli to the client's ears, one at a time.
And now she'll be presenting the sound from the audiometer. This is the audiometer which you are seeing. So the frequency which she is presenting is about 1 kilohertz. Now the intensity she is increasing. So till the person hears that sound, she will keep on increasing the level. Now it is -5 dB. So she will keep on increasing. Then she will mark the threshold at what level he is hearing at that frequency. Then she will move on to the next frequency, that is 2000 hertz. Then he's hearing that sound at 30 dB. He has given his response. So like this, it goes to a range of frequencies. It starts from 250 hertz, then 500 hertz, 750 hertz, 1000 hertz, 2 kilohertz, 4 kilohertz, 8 kilohertz, done at all these frequencies. So at each frequency, the level at which the person is hearing is noted. Okay. So this was about the audiometry part. So we call it as pure tone audiometry because the sound which is presented, they are sounds of single tone, of single frequency. So starting from 250 hertz, 500 hertz, 1 kilohertz, 2 kilohertz, like that it goes on. It is conducted in a quiet room setting. The room in which the test is conducted, it has to be free from other sounds. There should not be any noise in that room, and it should be totally cut off from other sounds. Then only we will precisely able to detect at what intensity he is hearing each of the sounds which we are presenting. So the range of frequencies at which the test is done is from 250 to 8000 hertz. So at this juncture, you will have a doubt that the frequencies which we can hear is from 20 hertz to 20,000 hertz. Then why the test is done only at 250 to 8000 hertz? So even though our hearing mechanism is able to respond to sounds up to 20,000 hertz, the range of frequencies which we hear normally through the speech or music all lies in this range of 250 to 8000 hertz. So that is why the hearing level is tested. So after this audiometric evaluation, the report is given in the form of audiogram. So you see the two different audiograms there, right and left. And what is being marked at each frequency is the level at which the person is able to hear. So at 250 hertz, the level at which he is able to hear is at 80 dB. 500 hertz, the level at which he is able to hear it at 70 dB. 1 kilohertz, he is able to hear at 80 dB. So like that. Okay, same for the left ear also. Okay, so then there is a standard scale with which the severity of hearing impairment is classified. So if you are able to hear in this range, that is -10 to 10, then -10 to 20. So if your graph, which is down now, if it was here, somewhere here in this range, you would have had a normal hearing. So this particular person, the graph lies in this range. So he is said to have a moderately severe hearing loss. So that is about 60 to 65% hearing loss. Okay, so if he has to hear a sound, it has to be 60 to 70 dB higher than what we normally hear. And after this pure tone audiometry is done using the same audiometer, a test called speech audiometry is also done, where we will be presenting about 30 words in his language, the language with which he is familiar, and he would be asked to respond back or speak back the words which he is the words in the way in which he is hearing. So if he is able to say correctly all the 30 words which are being presented, then he will have a speech identification score of about 100%. Okay, and if he is replying say 20 words correctly out of 30 words, so 20 or 15 words correctly out of 30 words, then he has a 50% speech identification score. So this test is also done to confirm the audiometry test. This is the test which we saw in the video. This is basically to find out whether your middle ear is perfect or not. So when we show in the initial slides, when we saw the causes of hearing loss, the causes can be, the reasons can be because of the problems in the middle ear also. So with this test, they would, after the audiometry, once you are identified to have hearing loss, then they have to identify which portion of the ear has problem. Okay, so whether the middle ear has a problem. To identify the problem in the middle ear, whether the middle ear is functioning properly or not, they use this test. This is basically a test which plots the impedance of the middle ear, okay, at different pressures. So a positive and negative pressure is created in the ear, and at these pressures, how the impedance of the middle ear varies. So if your middle ear is perfect, then you're all supposed to get a curve like this, and if there are problems in the middle ear, the curve will be something like this. So it will be so as you see here, the peak here for a normal ear is at about 0.7 to 0.8 millimole, whereas the peak here is about at 2 millimole. Okay, so instead of 0.7, the peak is at 2 millimole. So this is the tympanogram of a middle ear, a disordered middle ear, or an abnormal middle ear. Now, the audiometry test which we have seen, they call it as a subjective test because we need the response from the person being tested. Okay, we will be presenting tones, and the tones presented, whether he is hearing or not, he has to tell himself. That's why it is called a subjective test. But in many cases, the responses from the client may not be appropriate. For example, if the person is coming for a hearing test to get some benefits for his hearing disability, so he must have been instructed by somebody that such a test is there, and when you go there, they'll present tones, and you should not respond to anything. Even if you are hearing that, just keep idle, don't respond to that, because if he responds, then his hearing level will not be of that range where he can get the benefits of hearing disability. So that is one case. The second case is small children. As you see in this picture, there's a small child which is just 2 months or 3 months old. How can we do the audiometry for a 3 months old child, whether to know whether the child is hearing perfectly or not? The child will not be able to give the response when we able to present sounds. Okay, so in such cases, we use a device or a technique called auditory brainstem response, where the sound is presented into the ear, and the responses, the auditory responses, are collected with the help of electrodes placed on the head. So as you see in this picture, there's one electrode placed on the forehead, there's one electrode placed on the right ear, another electrode placed on the left ear. So with these three electrodes which are placed on the skull, we get responses from the child. Okay, and from those responses we will be able to identify whether the child is responding correctly or not. So now these are the major technologies which are used for hearing testing. So here you can see when we get the responses through electrodes, if it was a normal ear, the response is like this, and if it is a ear with profound hearing loss, so you cannot see any peaks in these waveforms. The waveforms are more or less flat. So if the hearing loss is in the moderate range, that means your hearing loss is about 35 to 40 dB, then you get graphs like this. So by comparing these graphs, you will be able to know whether you are hearing properly or not. Okay. So another area of research here related to this auditory brainstem response is that you give sound to the ear, and when you get waveforms like this, with the waveforms which I have shown are pretty good waveforms, but it's very difficult to get such good waveforms. So what happens is when the sound is presented to the ear, the child is given a little bit of sedation by giving some paracetamol or Finargan, something like that. The child would be sleeping. The child has to be in sleeping condition for us to get the good response. So if the child is sleeping quietly, then we will be able to get good responses like this. But if the child is moving here and there, or if the child suddenly gets up from the sleep, it's very difficult to get such responses. Okay, so the current research which is going on now is, once you get the waveform from the child, instead of doing perceptual analysis, instead of an audiologist just by looking at the waveform giving a diagnosis, can we use artificial intelligence to give the diagnosis? So can we convert the waveforms which we are getting into the into audiograms like this? Because to get an audiogram like this, you have to do audiometry, and for children it's very difficult. It is impossible to do the audiogram. So can we convert these waveforms into audiograms? So that is one kind of research which is going on now. Another kind of research which is going on is getting an audiogram through artificial intelligence. So I have explained to you the procedure of getting an audiogram. You have to undergo the pure tone test, that is the test at different frequencies. Okay, so usually a pure tone test, if you start from 250 hertz and till you reach 8 kilohertz, the time duration for that test is about 25 to 30 minutes. Okay, so what happens is, first you will hear tone of one frequency, then you will hear another one, and all these sounds are tones, and it is very irritating to hear these tones. Okay, so the limitations are, number one, the time involved, it's too long a test, and number two, it is it's a very boring test. It's a monotonous test, so people may not cooperate towards the end of the test, and it leads to wrong diagnosis. So considering all this, this is a research which is going on now. Can we generate an audiogram through artificial intelligence without doing anything on the pure tone side, without presenting any tone into your ear? Can we do that? So there is a development going on at University of California, San Diego, where I got an opportunity to do my postdoctoral training. So what they have done is they have developed a device like this, which is a wearable device, and there are two earphones which are connected to this device. Okay, and this in this device you have option to change. So what the device does is, instead of giving these tones, it generates some words. Okay, it presents to your ear some 10 words, some 10 selected words. So if you are not hearing the words correctly, suppose the first word is presented, and let us imagine that the first word is hello. So if you have difficulty in hearing this hello, you are asked to change the settings. So you can change this button. You can, if you press more, the sound will become more clear. You can press this button. Here also, if you press more, the sound will become more clear. And here also you can do. So once you select, once you are finalized with a particular selection, your selection is compared with thousands of audiograms which are there in the database. Okay, and from the selection, you will get an audiogram which matches to your selection. Okay, so this happens for word number 1. Similarly, the test is repeated for word number 2, 3, 4, 5. So to complete 10 words, it hardly takes 3 to 4 minutes. And in 3 to 4 minutes, using artificial intelligence, your audiogram is ready. So the advantage here is there is no time involvement. The time involvement is very less. The person doesn't have to listen to those monotonous tones. He is hearing words which he uses in his day-to-day communication. You don't require a soundproof room to conduct this. The only requirement is that the noise level should be a little less. In normal quiet rooms, you can do this test. You don't require an audiometer. What you require is only this small device which can be, which is a wearable device. So this research is almost in the final stage, and very soon we would be, I hope that we would be able to replace the conventional test. Now, this is another beautiful test which is available right now. Um, if we detect the hearing impairment at an early stage, okay, because in reply to Dr. Vijay's questions, I have said that the persons who have difficulty to hear, automatically they will have the difficulty to speak also. So if we detect the hearing impairment at a very early stage, immediately after the child is born, then we can correct his hearing problems very easily at a younger age. Okay, but we cannot do audiometry at that time, because the child will not be able to respond to that. We cannot do the electrode test which we are doing, because to do that test the child should be at least 3 to 6 months old, and then the child should be sleeping comfortably when the test is done. So because of all these issues, it's very difficult to find out whether the child has a hearing problem when the child is born. So this particular test, this particular technology can test the hearing of a child, whether the child has a hearing problem or not. Okay? It's not a complete diagnostic test, but it will just tell you yes or no, whether the child has a hearing problem or not with this test. So how this test is done is, you see a small handheld device here and a probe which goes into the ear of the child. So through this device, a particular sound is presented into the ear, and once the sound once the sound travels through the outer ear and middle ear and reaches the cochlea will generate a response to the sound. This will originate from the cochlea, and that response, which is coming from the inner ear, is collected back by this instrument. So if the response will come only if the child is hearing it. So that's a very innovative way of doing the hearing testing, and this can be done within 12 hours of the birth. So if the child is born today, tomorrow you can conduct the test. If the child is born today morning, today evening, you can conduct the test. Okay. But I tell you, this will tell you only yes or no. So if your child is detected to have a hearing problem, there are ways with which the child can be tuned, and there are correction measures with which his hearing problems can be set right. Okay, so this is a very what you call is a very good development in this field. So with this I have completed the first section. Again, we'll take a small pause here, and we will just see if anyone has any questions. You are free to ask questions using your microphone as well as your chat box. Okay, so I have quite a few questions in the chat box. What is the response from forehead electrode? So the forehead electrode is a reference electrode. So you have one electrode on the left ear, the other one on the right ear. Forehead electrode is the reference electrode. Okay, so that's a good question. The responses are collected from the electrodes on the left ear and right ear. The electrode on the forehead is the reference electrode. Another question is cochlear response is electrical or sound. Okay. The cochlear response is sound. It comes out as sound, which is collected by a microphone in the device. In the OAE test, they have a microphone to collect that. Okay, so that's a very good question. Another question is, in OAE testing, how the contact is established with the cochlea. Okay, there's no contact with the cochlea. You are sending sounds into the ear, and once the sound reaches the cochlea, you get the response from the cochlea. The sound is delivered at the ear only. The probe is placed just at the entrance of the ear canal. The sound is delivered only. The sound travels to the outer ear, middle ear, and reaches the cochlea and comes back. So in that process, all the sections of the ears are tested. because you will get the response only if the sound reaches the cochlea. The sound reaches the cochlea only if the outer ear and middle ear are perfect. Okay? And the response will be generated only if the cochlea responds to that sound. So that means if the response is generated, that means the cochlea is also fine. Thanks, Arun, for asking that question. Any other questions?
Sir, I have a question. So during the scanning of the fetus, is there any method to find out the membrane or the cochlear impairment growth during the trimesters? Is there any imaging based diagnosis possible?
No. Right now, the imaging cannot detect any of the problems there. It can be detected only after birth.
Okay, yeah, thank you.
Only after birth. Okay. So, shall we move ahead?
Yeah, sure, sir.
Okay. So now we are coming to the second part of my topic, that is about the speech disorders. So here also we will go through very quickly. We will go through the different types of speech disorders and the technologies which are used to detect and assess speech disorders and the current research in the area. So this slide will give an answer to Dr. Vijay's first question. Now, when we talk about communication, the communication is achieved through speech. Okay, so when I'm communicating to you now, I'm using my speech mechanism. So what I'm doing is I'm uttering different sounds, which combined together will produce words, and those words, when I combine systematically using my language rules, it becomes a meaningful speech. Now the question is, who has told me how to produce these sounds? Say, for example, in the word hello, I'll be using the sound ha, I'll be using the sound a, and I'll be using the sound la and o. Okay, so it's a combination of 4 utterances. Who has told me when I say ha, I have to hold my tongue in a particular position, I have to hold my lips in a particular position, I have to hold my teeth in a particular position. I have acquired this art of pronouncing each sound through imitation. It was not taught to me in my nursery class or LKG class or UKG class, but I have acquired these sounds through imitation. Okay, how will I imitate? I will be able to imitate only if I hear those sounds. Okay, so that is the reason why the first language which we learn, it is called mother tongue, because we learn to utter these sounds by imitating our mothers, because mother it is a mother who communicates to us with the help of sounds. So we just simply imitate how the mother speaks to us. So when the mother says ah, we just observe the position of the lips, observe the position of the tongue, observe the position of the teeth, and then we just imitate that. So that is how the sounds are produced. So each and every sound which we produce, we learn it through imitation. And if we have to learn it through imitation, we have to hear those sounds. So that is how the hearing impairment is connected with speech impairment. So if you are unable to hear, or if you have some impairments in hearing selected sound, then it will be very difficult for you to produce those sounds. So that is why it is said that if you have hearing problems, it has to be corrected at the earliest age. Okay, so that's why all these technologies have been developed to detect it within 12 hours of delivery, to assess it within 3 months. All these technologies have been developed to identify whether you have hearing problem, or to assess what is the kind of problem which you have, whether the problem is in the outer ear or middle ear or inner ear. All these technologies, they concentrate on detecting the problem at an earlier stage, so that the hearing problem is corrected and your speech learning through imitation, that happens automatically. So if you are identifying that the child has a hearing problem at the age of 3, already the child has lost his opportunity to learn all the sounds which he should have learned at the age of 3, okay, except 6 or 7 sounds. At the age of 3, 90% of the children will be able to speak 99% of sounds, okay, which you have lost because you have identified that the child has a hearing problem. So most of the time we identify the child has hearing problem because of the delay in start of speaking. The child is not speaking properly, the child is not responding to sound. All this identification comes at the age of 2.5 to 3, because normally we believe that after the age of 2, the children should start speaking words and sentences. Okay, so if it is identified at that age, it's very difficult to correct it. But if it was identified at the age of 3 months to 6 months, you could have already corrected his hearing mechanism with the help of hearing aids or cochlear implants, so that his speech learning goes through in its normal process. He would be able to imitate sounds. Okay. So now the production of speech is a coordinated effect of 4 systems. Okay. First is the respiratory system. The lungs have to expire air for speech to get generated. Okay, so in the respiratory mechanism has got both inspiration phase and expiration phase. The speech happens during the expiratory phase. So when you expire air, the air comes out through this cavity, which starts vibrating the vocal fold. So what you are viewing now is a vocal fold vibration. Okay, so this vocal fold vibration is because of the air which is coming out of the lungs. So your respiratory system has to be perfect for this to happen. So to have speech, the basic start of speech, it is from the lungs. So that is why you must have observed that people with wheezing problem, they have difficulty in speaking. And for us also, suppose if we suppose to catch a bus or a train, suppose we have to run a little bit, then it will be very difficult for us to speak. That is because if you have, when you have a wheezing problem or during running, your expiratory phase becomes very short. So then you will not be able to speak words comfortably. Okay, so respiratory system, phonatory system, and next comes the articulation system. Okay, so the articulation system, after the vocal folds produce the basic sound. So when I say my vocal folds are producing, but I'm able to produce different sounds. Okay, even though the vocal fold vibration is of a single frequency and it continues to generate that tone, I'm able to produce different sounds because of my articulatory system, which includes the oral cavity, which consists of the tongue, the palate, the lip, teeth, etc. So when I hold the tongue in a particular position, when I hold the lip in a particular position, my teeth in a particular position, I'm able to produce a particular sound. So for example, when we produce a pa, it's the sound pa. If you observe, the lips are in a particular position, the teeth are in a particular position. Contrary to that, when you produce a sound ka, that's the positions have been changed totally. The lips are in a different position. So for each sound to be produced, the articulators have to attain a particular position, which we learn through imitating. And the control of all this comes from the central nervous system. Okay, so it is a nervous system which initiates the action of lungs, which initiates the movement of the vocal folds, and which tells us how we have to keep our articulators to produce a particular sound. Okay, so that is why when people get affected with stroke, they lose their speech because the brain will not be able to control all these activities. It is a well coordinated activity of these four systems that results in the speech. If you have impairment in any of this, if you have a problem in your phonatory system, respiratory system, or articulatory system, or in the nervous system, then you will have speech impairment. Okay? So now, when we say a normal speech, a normal speech is considered as a speech which is at a normal rate, at a normal rhythm, and where the sounds are uttered with precision. So when I say sa, instead of sa, I will say sha, then my precision is lost. So when I say sha, instead of sha, if I say sa, my precision is lost. Okay, so precision, rhythm, and rate, these leads to normal speech, and this is the precision is controlled by the articulatory system, whereas it is the glottal system which controls the rate, and the rhythm is a combined activity of the glottal and the articulation system. Okay. So now, if you have problem in precision or rate, or the rhythm, it can lead to speech disorders. Okay, so with this, let us move to the different types of speech disorders. So this is one type of speech disorder which is called the speech sound disorder. Okay, so in speech sound disorder, the precision is getting affected. So the for example, the sound sa, the sound sa. Most of the children with speech disorders have difficulty in producing the sound sa. So when we ask them to say the word bus, instead of bus, they'll be pronouncing it as bach. So sa, the sound sa is getting changed to another sound cha. Okay, so this is called a speech sound disorder. Another sound which has got problem is ra. Ra is the toughest sound to be pronounced, and when people have problem in this precision in the articulatory system, instead of ra, the ra will be pronounced in different forms. Okay? So the structure and function of articulators and the hearing mechanism are responsible for generating precision sound. So as I said earlier, the sounds are imitated, and to generate a precise sound, you need a precise hearing mechanism. So you should hear the sound ra, then understand the position of articulators, and then you will be able to pronounce that ra correctly. Another problem which can happen, which may result in speech sound disorder, is because of the problem in the vocal tract. So when the lungs pump out air, and once the vocal folds start vibrating, the physical structure of the articulators have to be perfect. So if that is not perfect, so if there is a cut in your lip, or if there is a cut in your palate, then it can lead to imprecise articulation, which may lead to a wrong sound. So you are intending to pronounce a sound sa, but instead of sa, you are pronouncing something else. Another type of speech disorder is called dysarthric speech, which is very popular, and this can come because of the once you lose the muscular control. So the muscular control can be lost because of stroke, or because of accidents, or because of this Parkinson's disease, where your muscular coordination is getting affected. Okay, head or neck injuries, or a condition of cerebral palsy, where you have problem in coordinating your muscular and bone movements. Okay. Weakness or paralysis, all this will result in a dysarthric speech. So in a dysarthric speech, it's very difficult for them to produce the phonation. Okay, so for example, if I can produce like this, a dysarthric person will be producing only the air will be there, but the movement of the vocal folds will not be there, the phonation will not be there, and that is a typical example of dysarthric speech. The third type of speech disorder is the stuttered speech, which is again very common, and it is seen in many children, even in normal children also it is seen. The exact cause of stuttering is not known, but if we identify the stuttering at an early stage, we can correct it through continuous speech therapy sessions. Okay, so in stuttering, the repetitions, for example, if I stutter, because many movies have come, so most of us are familiar with the problem of stuttering. So if I'm saying, say, boy, then I'll be repeating some phonemes in that word. So for example, boy, where I'm repeating that ba 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 sound. Okay, it can also be because of prolongation. So instead of saying, say, boy, if I say bo bo, so that is prolongation. And it can also be because of blocks. So to produce certain sounds, you are unable to articulate that sound, and that results in a block. For example, if I have to say cashew, I'll say cashew. So there is a block there. Okay, so these are all examples of stuttered speech. The fourth category of disordered speech is the voice disorders. Okay, so when I'm speaking to you, I have to speak. I'm speaking in the normal voice. So instead of that, if I speak like this, hello, how are you? So that is called a hoarse voice. Okay, where the voice is not normal. Okay, and then especially in people with the asthma problem, you have breathy voice. There is a lot of air which gets mixed up with the speech, and it will be very difficult to comprehend what they are speaking. Another problem is puberphonia, where you have a problem usually when the boys, when they attain a particular age, or when they attain maturity, their sounds should change from a female voice to a male voice. So if that doesn't change, and if that female voice continues, then it is called puberphonia. Okay, so these are all examples of the major category of speech disorders. I've not covered the entire category, but 4 major categories I've covered: speech sound disorders, stuttering, dysarthria, and voice disorders. Okay, so here we take one more small pause before going into the next part of my presentation. If you have any doubts or any clarification, I'll be happy to answer that. Okay, some questions are there in the chat box. Stammering is also kind. Yeah, what I mentioned by stuttering, what I meant by stuttering is stammering. Stuttering is the scientific name for that, and stammering is the colloquial name for that. Stuttering and stammering are more or less the same. Okay, then a question from Ashok, which says, does autistic children respond to sound? Okay, so that's a very difficult question to answer. Autism, what you call as autism, is a spectrum of disorders. Autism is because of a spectrum of disorders. So that is why it is called autism spectrum disorders. So in some group, they do not respond to sound. It's not because that they're not hearing. It's not because that they're not hearing. Their hearing mechanism is perfect, but they don't respond to sound. So that is because of the lack of attention from them. So we do have a different mechanism to make them attentive and regain their responses. Okay, so that was a very good question. So they there are autistic children who doesn't respond to sound, but that is not because of any problem in their hearing mechanism. It is because of their attention problems, which can be definitely corrected with different ways of therapy sessions. Do we have any other question? So hope everything is fine with everyone. So we move to the last part of the presentation, where we are going to discuss the technologies to detect and assess speech disorders. Okay, so we'll see the existing methods, and along with that, the current research which is going on. Okay. So the strategy for assessing the speech disorder, it is a mixed strategy. The existing techniques are all most of the techniques which are existing now, they use a combined strategy of perceptual evaluation and evaluation by instruments. Okay, so when we discussed about the cause of speech disorder, I had mentioned that a normal speech is the result of a perfect respiratory system, phonatory system, articulatory system, and the nervous system. So when we assess the speech disorders, or when we find out the severity of these speech disorders, like in the hearing mechanism, we had classified them as mild hearing loss, moderate hearing loss, severe hearing loss, profound hearing loss, like that. So the speech disorders also can be classified as mild, moderate, severe, and profound. Okay. So this classification is based on assessment of severity, and this severity assessment is done through a combination of perceptual evaluation and evaluation by instruments. So therefore, it is a very time-consuming process. For example, if I have to assess the dysarthric speech, a person who is having dysarthria, how severe is his speech disorder? First, I have to do the check his respiration level, for which I'll be using an instrument called spirometer. With which, the spirometer is an instrument used to find out the capacity of the lungs, how much air it can, how much volume of air it can inhale, how much volume it can exhale, and what would be the respiration cycle, how many times of inhalation and exhalation happens in 1 second. Then after assessing respiration, then I have to see the phonatory mechanism, where the glottal source is functioning properly or not, whether the vocal folds are vibrating properly or not. For that, I have an instrument called electroglottograph, where I connect. If you can concentrate on the first picture on the left side, where the electrodes are connected on both sides of your throat, and you will be asked to phonate and when you are phonating the vocal folds come in close contact with each other, and when they come in close contact with each other, the resistance becomes less, and there will be an opening phase of the vocal folds where the resistance is maximum. So what you see as a graph here, which is called electroglottograph, the bottom portion shows the closed phase of the vocal folds. These peaks shows the opening phase of the vocal folds. Okay, so whether these opening and closing is happening with a particular rhythm. So if you see the opening closing phase, they happen repetitively, periodically, at regular intervals. So that is found by the instrument called electroglottograph. Then I have to see whether his muscular controls are all okay or not. The dysarthric person's muscular control, I have to check. The articulation mechanism, I have to check, and that is checked with the help of by taking the spectral component of the speech. The speech signal is being recorded and the spectrum is analyzed. So by analyzing the spectrum, we will know that we will know whether he is pronouncing all the sounds correctly, especially tough sounds like pa, sa, ta, like that. Okay, by analyzing the spectrum, we will be able to know. And then we also have to check whether the sounds have a nasalience or not. For example, when a person with a speech problem, when he pronounces, say, one, he will be pronouncing it as hot. That wa sound which has to come through the mouth, part of that is coming through the nose. So that condition we call it as nasalience. Okay. So when this assessment is done, all these instruments are also used, and then the perceptual evaluation is also done where a particular test material is used. So this test material contains sentences or phrases like this. The therapist, the person who is assessing, the speech language pathologist, will instruct the person to speak this sentence, and from his speech, the therapist will analyze the abnormalities and then make a perceptual assessment. Okay, so this is the existing mechanism, and in this existing mechanism, we need a lot of research to convert these mechanisms to automated assessment. So the problem with the existing mechanism is, number one, it involves perceptual evaluation, which requires time. So in this list, you see about 30 sentences. So the therapist has to tell the person to repeat these sentences. So first, the therapist has to utter these sentences, then the person has to repeat. Okay, so this itself is a time-consuming process which takes about 40 to 45 minutes. Along with that, they have to do all these examinations. So a complete speech evaluation will take almost 7 to 8 hours if you are doing it in one day. If you are splitting it into 2 days, then it may take more time. Okay, so this is the time involved is one major concern. The second major concern is when you are spending so much time on one patient. So if you are spending, say, 40 to 45 minutes or on one patient, it depends on how efficient the therapist is, how efficiently the therapist, the speech language pathologist is able to record the responses from the person and then diagnose precisely what is his problem. So a lot depends on the experience of the speech language pathologist, and the number of speech language pathologists available are very less. And the third bottleneck is these sophisticated instruments. So if I can give you a brief idea about the cost of these instruments. The first instrument is EGG. The cost of that is about 2 to 3 lakhs. The spirometer is again, it costs about 6 to 7 lakhs. The mechanism for taking the spectrogram and analyzing it, that again costs a few lakhs. So if I put the cost of all these instruments together, it costs about 40 to 50 lakhs. Okay, so who can afford, especially in our situation, who can afford these kinds of sophisticated instruments? And that is why we have to concentrate on finding automated techniques for assessing the speech disorders. And when we talk of those techniques, the major hurdle is how to process disordered speech. At least some of you must have worked in the speech processing area. You know how difficult it is to process a normal speech or to recognize a normal speech. Okay, so the major bottleneck or the major hurdle in automizing the assessment of severity of speech disorder is the difficulty in identifying or detecting the disordered speech and processing the disordered speech. Okay, So most of the research in this area are now focused on to develop a comprehensive diagnostic system for severity assessment by completely removing the perceptual and the different instrumentation methods, by consolidating all of them. So if we just through speech processing, if we are able to assess the severity, and that is the kind of research which is going on here. Okay, now when we consider the steps in assessment of disordered speech, there are two steps. First is the screening and second is the identification. So screening tells you whether you have a speech problem or not. And once the screening is done and once it is identified, then comes the assessment. Okay, so again, like hearing disorder, if you assess the speech problem at the earliest, it is fine. Now, to assess a speech problem, first you have to get the speech from the child, and the child starts speaking only after, say, 9 months or 12 months, depending on the child's ability. But we are blessed with a mechanism which is the cry, which is considered as the first speech. Okay, so there has been quite a lot of research which has gone into the analysis of this cry, and can we find whether the child has a speech problem or not by analyzing this cry. Okay, so this research which is going on in our institute, you can refer this paper for more details. Okay, so they analyzed different characteristics of the cry, the duration of the cry, the fundamental frequency of the cry, the noise related parameters, and they found that there is a significant difference between a normal cry and a disordered cry. So if you see these waveforms, the first one represents a normal cry and the second one represents a disordered cry, the cry of a child with speech problem. So when they analyzed the different parameters, they found that some of the parameters, for example, the fundamental frequency. So F0 is the frequency at which your vocal folds is vibrating. So the frequency of vibration of the vocal folds can be detected from the cry. So when we analyzed that, we found that the mean value of F0 for a normal child is 512 hertz, whereas a child with abnormal speech is producing a cry at this particular frequency. Similarly, there are other parameters also, like noise to harmonic ratio. For a healthy child, it was found to be 0.1808 when we have taken the average of about 220 normal children, and for a children who is at risk for a speech problem, we got the value of 1.82. So these are significantly different values. So like that, we found a few parameters which are different, which makes the cry of a healthy child different from the cry of a child with speech problem. But these are all preliminary results. We have to do extensive study with more number of children to establish our findings, whether our findings are constant for a larger number of population. Okay. Now, when we consider the speech sound disorder, when I had explained you about the speech sound disorder, saying that they lose precision in uttering certain sounds. Okay, so for example, bus, they'll pronounce it as butch. Cashew, they'll pronounce it as kaju. So like that. So different sounds gets replaced. Okay, so the kind of test which is used to assess this kind of disorder is called the articulation test, where you will be presenting a number of words, 40 to 50 words, and these words are language based words. And when these sounds are presented, when these words are presented, how the child is responding to each of those words. Has each of the sounds in those words, are all of them being pronounced correctly or not? So when the speech language pathologist completes this test, it takes about 1.5 to 2 hours. So you imagine a small child of 3 to 5 years of age engaging him for the test for such a long time. Okay, so that is the major limitation in the existing methods. Okay, so in these speech sound disorders, the common types of errors which are found are classified into 4: substitution, omission, distortion, and addition. Substitution means you are substituting. That bus butch example which I told, that is a substitution. So this is another example of substitution where they say chair for chair. The sound cha is replaced by, substituted by the sound ta. Omission is another speech sound disorder where, for example, the word is fish. Okay, so they will omit the first part, fish. They'll say fish. Or if the sound is cat, instead of they'll omit that first sound k and say at. Okay. So these are examples of omission. Then we have distortions where certain sounds. So it's the sounds like sha, ra, ha, instead of sha, they'll say sa. So sha is getting distorted to sa. Another articulatory error is the addition. For example, plane, they'll pronounce it as plane. Okay, the sound o gets added there, so that is an addition. So these are all examples of speech sound disorders. Okay, so an ongoing research is to find out these errors automatically from the speech. Okay, so they will be asked to pronounce certain words or utter certain words, and from the words uttered, after processing the words uttered, the substitution error, omission error, distortion error, addition error are found from the speech signal, are found from certain parameters of the speech signal. In the similar way, we analyzed the infant cry and found whether they have speech problem or not. This research is going on in our group in a collaborative project with IIT Guwahati. This is a project under the Imprint program. This has reached its final year now. The project is going to end next March. So what we have found is that each of these errors, substitution error, addition error, we have found a parameter in the speech signal with which these errors can be identified and quantified. So this is a system which we have developed. Now here you can select the language, and once you select the language, you will get the sounds one by one. So we have concentrated on 2 languages now. One is Hindi and the second one is Kannada. The words will pop up. The child has to pronounce this word, and when the child is pronouncing this word, the word gets recorded, and then what error that word has, whether it had substitution error, omission error, distortion error, or addition error, that is found automatically by the system, and at the end a report is generated. So please refer to these publications if you want to get more details on that. The next research which is going on is to assess the severity of persons with cleft lip and palate. So you must have seen several children or several persons. You must have met several persons in your life with a cleft in the lip or in the palate. So what happens in this case is, once you have a cleft in the lip, where you have a cut in the lips or cut in the palate, it is very difficult to pronounce certain sounds because of the abnormalities in the speech system. So usually what people do is, since it is an abnormality which is immediately visible, they correct it with the help of a surgery. So this was a child with this cleft lip and palate. The same child, after surgery, you can see how beautiful that child is looking now. But the problem here is, even after the surgery, the speech problems in the child will not get corrected. Okay, so to correct the speech problem, continuous speech therapy has to be given, because the child has acquired the speech with the cleft lip palate. So the child has developed articulatory mechanism to pronounce a particular sound based on his cleft lip and palate. Now the cleft has been corrected with surgery, so the child has to change the articulation technique, which is achieved by continuous speech therapy. Now, when we do continuous speech therapy, we have to fix a protocol for how to go about this therapy. And to fix the protocol, first, the severity has to be assessed. Severity of disorder in the child has to be assessed. And when we use the conventional techniques, again, we require most of those costly instruments which we have discussed. So this is the spirometer in action. This is the nasometer in action. So what we have tried to do, again, this is a collaborative project funded by Department of Biotechnology, which we are doing in collaboration with IIT Guwahati. So we are trying to find out the parameters in the speech signal, which tells us about the severity of the disorder. Okay, so voice onset time, closure duration, the formants, the vowel duration, syllable duration. So all these parameters were analyzed and they were used for detection of severity of the speech disorder. Okay. So by combining, after finding out the significant parameters and after combining all these parameters, we were able to generate a severity score. Just by analyzing the speech signal, we were able to generate a severity score, whether the disorder is mild, moderate, or severe. So this red block indicates the severe category. This indicates the moderate category. This indicates the mild category, and this indicates the normal category. So all this we were able to do by analyzing the speech signal, bypassing all the perceptual evaluation and all the costly instruments. So this is the current research which is going on. So we are doing for the speech sound disorders and the cleft lip and palate disorder. Several other groups are working on the stuttering fluency disorder and all. Some other groups are working on the dysarthric speech. Okay, so several groups are working on different types of disorders just by analyzing the speech signal using the deep learning or artificial intelligence, machine learning, how the speech signal can be utilized to express the severity. Okay. So with this, I come to an end of my presentation, and I should thank Dr. Vijay for giving me this opportunity to make this presentation in front of you. And if you have any doubts, please, I would be happy to answer your doubts. You can type the questions in the chat box, or you can switch on your microphone and ask questions. It's a very challenging field, the processing of disordered speech, because it's very difficult for us to recognize what the person with speech problem is speaking. Okay, so that is why the speech signal is very frequently used for this kinds of analysis. One more major problem which we face in Indian conditions is the the language part. Okay, so if you are developing a particular technology, it is language specific. And to make a technology which is common for all the Indian languages are extremely difficult, because each language has got a different spectral content. Okay, so there are gross differences between South Indian languages and North Indian languages. And among South Indian languages itself, we have a lot of variation.
Hello, sir. Good afternoon.
Good
Sir,
afternoon.
is there any kind of speech processing for animals used?
Can you please repeat?
Is there any kind of speech processing done for the animals?
Okay, you mean animal sounds? Okay, so animal sounds in Indian Institute of Science. There is a group which is working on that. So what they are doing is they are analyzing the animal sounds and finding out how they produce different sounds to express their different emotions. So when the animal is angry, what kind of sound it produces? When the animal is happy, what kind of sound it produces? And when the animal is under stress, what kind of sound it produces? Or if the animal is infected with some disease, what kind of sound it produces? So that is going on in that kind of research is going on in Indian Institute of Science.
Thank you, sir.
Sir, you given a lot of research prospects from your presentation. Even the system can be developed for the regional languages as well. So what about the sign language, sir? Because usually the child used to communicate through some sign language with a particular pattern. But here also we have different sign languages. Some of them follow American Sign Language and the sign language which is available in Sri Lankan Sign Language, even for the Tamil language. Here the sign language differs. So can you little bit brief about the sign language in the case of disorders pertaining to,
the major problem with sign language is when you are communicating with the sign language, the person on the other side should also know the sign language. That is a major hurdle. Okay, so if a disordered a person with hearing impairment is communicating with you, it's not necessary that you should know the sign language. Okay, he knows the sign language, but unless you understand that, his communication is waste. Okay, so there are different technologies coming up now where the sign is automatically converted to speech. Okay, so the person will be carrying a device which detects his sign and converts it to speech. So he will communicate to you in sign language, but you will be hearing it through speech. Okay, so sign to speech conversion is going. That is one ongoing research, and the reverse also, speech to sign. Okay. Now, as you rightly said, we were not having any sign language. The Indian Sign Language came into existence only a few years back. And within Indian Sign Language, now the Government of India has started an institute exclusively for sign language. That institute is in Delhi, and they have developed a vocabulary of 6,000 signs, where there are regional variations. So some signs, when you say in Assam, it has a different meaning, and the same sign when you sign it in Tamil Nadu, it has a different meaning. Okay, so these are the problems which they are facing, but more or less, at least they were able to build a dictionary of 6,000 signs of Indian Sign Language. That is a big achievement, because even when we want to develop automated systems, we should know this sign represents what speech. Okay, so I should get the sign and I should get the corresponding speech to build a system. Okay, that kind of systems, that dictionary was not available, but now they have launched a dictionary which will be very helpful, and I think with that dictionary, a lot of developments will happen on sign to speech.
So, yeah, thank you, sir. So just I want to place a record here. The Department of Biomedical Engineering is also doing research on speech disorders and as well as vocal fold analysis.
That's good. That's good.
Thank you, sir.
Already mentioned that many groups are working on this. That's a good sign, because I basically wish that more number of groups should come into this kind of research, because no one else can do this for us. Because when you talk about technologies, we can easily adapt technologies from abroad, but since our language is different, our culture is different, we cannot adapt their technologies here. We have to build on our own technologies. Okay, so when you do it there, when you do it in Tamil language, and when I do it here in the language of Kannada, all these researches are very relevant, because it is all language dependent.
Yes.
So that's why more number of groups should come into this, and with and most of the tools which are required for this kind of research, most of them are available online. And with MATLAB, you can do many things in this. So nothing is a barrier now. The cost is not a barrier. The accessibility is not a barrier, because all these are available as online tools. Only thing is that the effort required and the interest to do things. So
Yes.
I request the young researchers who are attending this session to divert your research, or to plan your research in this area, so that it should be beneficial to many number of people in our country. As I have projected in the initial slides, the numbers are very high. Okay. If we are getting 75,000 in a year in Mysore only, so you can just imagine the number of people with these kinds of problems in our country. Okay, so there are many, there's a large number of people who require these kinds of developments, and it would be very good if you can concentrate your research or divert your research students into these areas.
Yeah, thank you, sir. Thank you. Participants, do you have any questions you can ask? Okay, I think there are no questions. So thank you, sir. Thank you for accepting our invitation, and we had a very informative session from your end. Surely your talk would reach the young researchers, so that they will divert their research into a different domain. Yeah. Thank you, sir.
Thank you.
Thank you. Thank you, sir. Participants, our next session would start by 1:45. The session will be given by Mr. Shanta Kumar, Managing Director of Vital Biosystems. So he will be giving a presentation on the insertion of catheter. Thank you. Please join us by 1:45. Thank you all.